Interesting one here from Jason. Jason has asked what the link is with trigger points.
So trigger points I find an interesting topic. And I've wondered for a while, really, what is a trigger point? You know, it's not like there's a physiological lesion you can point to, right? So we know it's tender, and we know it's sore, and we know it refers. I think there's been some interesting studies where they've, with cadavers, basically peeled back skin, and the guys actually doing the dissections and stuff, they will often find where the nerves are by palpation. So they'll look for effectively trigger points, and when they find where this tight bit is, then they know they found a nerve, and it's often where it's passing through fascia.
Yes.
So from my mind, when we talk about trigger points, I think probably what you're looking at is a peripheral nerve passing through muscle or fascia. It gets impinged there. We get a build-up of edema. It swells. The actual nerve itself becomes swollen, and that's why you can feel it. You'll see with headache patients that when their headache is really bad, you'll be able to palpate the nerves on their head. Feel like copper.
Yeah.
So you come around here, or you come around here, and if you just run your finger sideways, classic one is if you try it yourself now, if you guys try it at home, if you come here, the supraclavicular nerve, it just pops over. If you run your finger back and forth, you might just get a slight sense of this kind of flat thing. So sometimes when patients report pain coming into their chest, if you palpate that, it feels like copper wire. So nerves generally should feel quite flat. When they're inflamed, they go like copper. And I think often when you find trigger points, it often feels like that. You feel this like little nodule. And then when you work on it, you're stretching the fascia, stretching the muscles, you're relieving that edema, and it goes. So I hope I don't get a whole bunch of hate mail from trigger point therapy people, but I think probably it's a peripheral nerve that's becoming trapped through.
I wonder if that's why Jason asked the question. I mean, we've run a number of courses here, primarily about dry needling, but dry needling all focused on trigger points. The two experts we've had, one is an osteopath, Simeon Neil Asher, the other is Professor Bob Gerwin, who's an American neurologist, and a very eminent neurologist from Johns Hopkins in Baltimore. And yes, they've defined what they mean by trigger points, but also Bob has come up with some recent research showing that yes, they do exist to counter all the naysayers who deny that the trigger points exist. And of course, it's not completely cut and dried, but certainly the needling that they teach and practice is effective in dealing with the referred pain patterns from those. And Simeon, together with Bob, they developed a 3D app, Trigger Points 3D, to show the pain patterns, and it is a phenomenal app.
So I've seen some other things where they will look at those pain patterns, and then if you were to look at some of the peripheral nerves, it is remarkable how often those pain patterns, those referred pain, follows the nerve. So you'll see, like you're palpating around like the QL, and you'll see a pain pattern follow into the adductors. But we got like the genitofemoral nerve that passes through a bunch of fascia and comes into that. So I find it very interesting, and it's not to say that they're not their own independent thing, but I think quite often you'll see, if you were to then pull up a map and look at the nerves, you'd be like, oh, that really. So with Grace back there, it'd be really tempting to say that was a trigger point referring pain down the back. But there's also a whopping great nerve that runs down it. So well, I suppose the answer is you treat it, and if it goes away, that's the most important bit, really, rather than the theory.
And that's the point of what they do as well. I mean, as they're teaching, you find a trigger point, a tender point in a taut band of muscle, you treat that trigger point, and suddenly all those referred pain areas cease to be painful, and they stay not painful as well.
Yeah.